Okay, hello everybody, and welcome to series two of the Nurse Career Accelerator event. I am so excited to be hosting this event again. The first, the series one, we held it in 2023, and a lot of people benefited from it. And I'm so amazed at the results that people are still getting from that event, right? So if you ask me, why did I start this event? It just started as an idea because I do love sharing a lot about nursing. I'm someone who loves nursing. I don't just do nursing because nursing is out there. I do nursing because I'm so passionate about it. I love being that kind of a person that can actually be caring and provide assistance to people. And because there are different ways of doing it, and when you're a nurse, you're very close to humanity. You get to interact with people a lot, your colleagues, your patients, family members, and that shapes a lot about your perspective and how you see life. So that is one of the interesting things that I love doing a lot about nursing. And if you ask me why I started this event, it was because a lot of the struggles that I had and I went through when I was still a student, I later on saw that those struggles was an advantage for me. They were like opportunities for me to learn and become a better nurse. And I think when I finished my level three and I was about to do my BSc in nursing, I started applying some of those lessons that I had learned throughout my year one, year two, and year three. And I saw that it was really interesting and it was really helpful. And even up to now, when I just newly qualified and I started my new role in the UK, the environment is different. You're meeting different people, not just from the same place like you're meeting people from different countries, from different continents. They have different cultures, they reason differently, they come with different ideas, different ways of doing things. And again, now you turn to readjust yourself and adapt to those new changes, right? And when I started this role, I do work in orthopedic theaters. Anyways, let me start by saying I'm Kendria Mboshi. I'm a registered nurse in the UK. I work in orthopedic theaters. And aside from my clinical work, I am a health and well-being strategist. And I do help a lot of nurses, especially student nurses and newly qualified nurses. As part of my clinical role, I am a student champion. That means I support student nurses in practice during their placement opportunities. And I love doing this a lot. Why? Because I turn to learn a lot from them. When people still come from the field and they have that fresh knowledge, they have that enthusiasm, they are coming with so much knowledge. So you're not only showing them what you can teach them, but you're also learning from them and you're also getting their different perspectives about life, right? So that throughout those periods of time when I just started my role, like the first 6 months, it was really, really difficult because, anybody who knows orthopedics know that orthopedics is a specialty where it needs a lot of reasoning because you're not only focused on providing instruments for the surgeon, you're also making sure that you understand the procedure, and any instrument that you're handing over based on how it is going. And that means you need to understand the anatomy, know what the procedure is, and know what like you're anticipating before time. And there are lots of equipment that you need to use just for one surgery. For example, for a knee surgery, you need almost like x-rays opened, and you have to know those instruments. So when I just started, I thought about it. I was like, this is just too much for me, learning all of this, juggling it with your life outside work, and being able to still cope with everything. So it was a lot for me. Then I sat back and I remember I reflected my journey back then and how I was able to survive some like difficult exam periods or presentations and different things that really shaped my nursing career. And I said, okay, I think this same formula that I used to learn those skills, I can still use them. And I tell you, within 6 months of my role, I was able to learn a lot. Why? Because one of the things that I had used was one of the 6 points framework for learning a new skill, and which is included in this training today. So in 2023, when we had this event, it was basically just the virtual point, just the virtual version, no frameworks, no worksheets. And then when I started preparing the material for this one, I was like, okay, I think there's time I include some of those things, the ones that have helped me, the ones that I've also used to give people out, because there are a lot of people that do reach out to me for guidance on their nursing careers. And I do tell them a lot of things, and they come back saying, oh, this was very helpful to me. I think I applied this and it really worked. I was like, okay, what if I turn this into a worksheet or into a framework that can help a lot of people? So that is the idea behind this Nurse Career Accelerator event. And like I was saying the other day, for those who attended our first focus group discussion, I was saying that you do not need to have everything before you start. There is always room for improvement, but you must have a plan. When you have a plan from the beginning, what is it how is it going to benefit you? Now, anytime you want to change something, you are only re-strategizing that plan. You're only re-editing it and making it to suit your current needs and what you expect to do. You're not going to plan all the way from scratch. That's why at every point in time, it doesn't matter, even if you're year one student, year two, year three, or newly qualified, it doesn't matter. You need to have a plan. So what you'll be doing is to trying to adjust that plan and see how you can bring them to actualization, not starting from a fresh all over again. It's okay if you came here not really having a plan for your career or not having a long-term goal that you really want to achieve. It's okay, but living today, you should be able to have something, a plan, or even if you don't have it like all figured out, you should have something, especially what you want to do in the future. Because we all train, especially I think most of us here are Cameroonians, we all train as general nurses, but you see that there are lots of other specialties that you can get into. And if you're a student, it is even more advantageous for you. Why? Because throughout your study period, throughout your placements, like we call it internship, you're able to go through different departments and you actually see how things are done there. You interact with patients, you interact with your colleagues, your senior colleagues, and you actually see how nursing is being done there. So at that point, you can start saying, oh, I really love how they attend to A&E cases. I really love how they do take care of this wound. So I think I'm really interested in surgical nursing. Or you'd be like, oh, what if I think about mental health? I think mental health could be a good option for me. I'm really passionate about how people think, how people take care of their minds and stuff like that. So that's you already having a plan as to what you want to do in the future. Or maybe you say, oh, I really love the way community nursing is going. I really want to help people know more about their health at the level of community. Be like, okay, I want to get into community nursing or public health nursing. So that is how you just start having a plan without actually sitting down to write it out that, oh, this is what I want to do. So from there, you'll see that your interests in those particular specialties will vary. There is no way that you go through 10 departments and you come back with the same experience. Sometimes the colleagues you meet there or the patients you meet may make your experience overall good, while others may make your experience overall, a bit not really good. Let me not say bad because every experience has a reason, So that can really help you to guide you to understand that, okay, this is what I expect, this is what I'm seeing, and this is what I want to do from this. So I will just give the floor to Stanley to introduce himself, then we can crack on from there. Oh, I think we lost Stanley. Okay, that's fine. I think we lost Stanley, and I think it's because of the network issues. So, as like I said in the beginning, please do let me know if you have any questions. There is no stupid question, and there is nothing that cannot. There is always an answer to every question, right? So don't feel like this question is a stupid question, or maybe I should wait to the end of it. No, if you have any worries as I'm going on, just drop it in the comment section, and I'll always check. I'll be checking the comment section from time to time to see if there is any worries. And even if after this session you're reflecting and you have a question, you can drop it in the group. If it's private, you can reach out to me. I'm always happy to help you. So the first and most important thing I want to start this session with is the winner's mindset in nursing. This topic, if I want to talk about it, I can talk about it from now to tomorrow. But because of for the sake of our time and because we have a lot to cover in those 2 days events, which is very, very small for considering the content that we have, is the winner's mindset in nursing. We do talk a lot. Okay, hi Stanley, welcome back. I was just saying that, can you please introduce yourself? Okay, so I'll just crack on. And if you're a bit more stable, just drop a comment, please, and then I will give you the floor to introduce yourself. All right. So the first aspect, like I was saying, that I want us to start talking about today is the winner's mindset in nursing. This is very, 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 very important. Like it is valid even in the next 10 years, we'll still have to talk about this topic. You know why? Because from the foundation of nursing, from how nursing started, it was reserved for the lower class, for women. And that stereotype, things in those days up to today, is still in people's minds. So when you talk about a nurse, everybody tries to look at it like somebody that is down there, right? And again, we as nurses, we are not trying to help this perspective at all because we often try to step back when we should be stepping forward. We stay quiet and shift aside instead of speaking up. So this mindset alone is very, very important. And if there is some one thing you're going home with today, is your mindset in nursing. Once you are very intentional about knowing that your mindset as a nurse influences how your career outcome becomes, then that will change a lot about how you see your nursing journey and yourself as a nurse. Okay, so think about it. If you've been through internships, you will see that you do meet different nurses, be it your charge nurse, the senior colleagues, or your student nurses. You will always have this common conversation around what they are expecting about nursing. Some people will say, oh, you see this nursing of a thing, let's just manage it. Or even sometimes people getting into nursing is because they had low grades, because they couldn't meet up to the standards and stuff like that. So they'll be like, let me just go and struggle there and see what happens. At least nothing is disqualifying me from that. So that mindset alone from the beginning, if you carry that mindset throughout, you will end up struggling. You will be on the opposite side of nursing. So your mindset is very important. What you think about nursing itself, how you see nursing, is very important. If you see nursing as an opportunity where you can contribute to your community, you can contribute to patients, you can build a beautiful career out of it, and you can make a living out of it, that is good and fine. But if you're looking at it as something that you're just managing, or you're just there because there is no other option, or it's the easiest way out, I tell you, you have to change that mindset today, because a lot of the things that you will be doing, a lot of the things that you'll be engaging on or in, will depend on that perspective that you have about nursing. So a winner's mindset in nursing is that kind of a mindset where you're not letting things around you determine what your nursing career will look like. You're not letting the voices around you, especially the negative voices, determine where you want to be as a nurse. Because if you look at it, the voices that are speaking negatively, especially close to us, about nursing, there are so many. From people blaming patient nurses, which is, sometimes it's understandable because a lot of things do happen. People blaming nurses, people looking at nurses as some, in short, the low class, people that could not get good grades. Others just looking at nursing like, okay, if anything goes wrong, this will blame the nurse. And majority of the time, that is what happens. Even when you're in hospital sometimes and something goes wrong, even if the nurse is not present there, you will see that at the end of the day, they will try to put the blame on the nurse. And I totally understand, because as nurses, we do spend a lot of time. We are the highest people that spend a lot of time with patients, on a daily basis. But that doesn't mean we should always take the blame for when things go wrong, especially if we are not directly involved in it, right? So you need to change your mindset. What do you believe about yourself? How do you see this nursing? Is this nursing thing just a survivor for you? Is it just something you're doing because you have no other option? Or are you intentional about making a beautiful career out of it? How do you perceive it? How do you see yourself? Do you see yourself like someone that is going to lead change in nursing, and, be that person where you are strategically positioned so that if any opportunity is coming, you will be that person that can be mentioned for it? Or you yourself, you can advocate for yourself. Oh, yes, we all are advocates, not just for the patient, but for ourselves. If there's an opportunity, you can always advocate for yourself. That is a beautiful thing about nursing. So the way you think about yourself, what you believe about yourself, do you really believe that the things that you really say sometimes, oh, I really want to be this person, do you really believe in it? Like, I'm asking, do you really believe in it? Like, has it settled within you that although I am not where I want to be, but I believe that someday I will be there? If you don't first of all believe in that one, it will be so difficult for you to get there, because sometimes challenges may come, or sometimes you just feel like I am not really, into it anymore, or feel low about yourself. If you've not believed about it, and you've not actually visualized it and seen yourself where you want to be, at the end of the day, you struggle a lot. So your mindset, your perception about nursing matters a lot. And I'm hoping that as I've introduced this session with our winner's mindset in nursing, you will carry this mindset on. Never ever compare yourself with anybody beside you, be it your senior or your junior. No, you have a separate life, you have a separate career. What you should do is, anyone's experience around you should help you to learn from it, right? And to help you to see how possible it is to, to get to where you want to be. I, for one, whenever I see somebody that is where I want to be, I'm like, okay, this is possible. That is the assurance that I have. I don't look at those who will tell you, oh, this is so difficult. Oh, there is nothing you can do out of this. That's a lie. Don't believe in those things, right? Don't believe in it. Ask yourself, is this what I believe for myself? Trust yourself and trust that whatever you're doing, and again, once you're putting in the effort, because to believe is one thing, putting in the effort is the second thing, and actually being patient and continuously believing in yourself until it is actualized is another thing. So believe in yourself first and foremost, and know that whatever you're doing, you're putting in your best in it and you are expecting the best out of it. All right, Stanley, welcome. Please, can you just quickly introduce yourself so that we can ride on, please?
Okay, thank you so much, Nesken. Apologies, I had some network issues. To everyone joining us this day, I salute all of you. I am Yingxia Stanley. I am a nursing student, a nurse advocate, and someone who loves professional development because I believe that for nurses to be respected, for nurses to be valued, they must follow a certain pattern, and that pattern is about like developing themselves, equipping their minds, because knowledge brings about competence, and competence brings about confidence. So I am all around professional development, personal development, and nurses achieving the best that they can achieve as far as their journey is.
Thank you so much, Stanley. Thank you so much. And again, please, if you have if you have any questions, please do let me know and I will respond to it. Them, just drop them in the comment section. So after that, from the winner's mindset, because I just want it to be very, very connected so that each point flows with the other one and we are building on each one until tomorrow when we finally get to the end of it. So the second thing I would like us to address a bit is this aspect of this imposter syndrome in nursing. Majority of the times when you see a nurse achieve something beautiful and you're about to say, oh, well done, they'll be like, no, they are trying to, we are shying away from what we are able to do. But we have a lot of skills. We have a lot of, a lot to share out there. But at the end of the day, because we just feel like, no, we are not really sufficient. That imposter syndrome is really, really roaming around us. And it only gets worse. Why? Because those that have gone ahead of us, if they are behaving that way and we have to learn from them, at the end of the day, we are also copying those things. Mind you, when we are copying skills, when anybody that teaches you, I did made a post a couple of months saying that the person you meet within the first 6 months of your role will determine how well you will perform in that role. And this also goes as far as the way the person behaves and stuff like that. Because if you, for example, if you start your placement and you're paired with somebody and you're working with that person continuously, involuntarily you end up copying the way that person behaves, right? And energies are very, very, it's transmissible. That is the way if you carry a lot of positive energy around you, see that that energy will always be positive. But if you continuously carry negative energy, I tell you, the environment will always be that negative. And that is the same thing. So if you're constantly associated with somebody that feels like, I don't deserve this, always feeling like they are not enough, I tell you, if you're not very careful and if you're not somebody who is able to create healthy boundaries, at the end of the day, you will start thinking like them. You will start behaving like that, and you will start thinking that this is also your reality, which is not true. So what I'm trying to say is, no matter where you find yourself, try as much as you can to guard your personal space. That is why it is important to believe in yourself, so that all those that imposter syndrome thing, it should not come near you, because it's easy to copy the negative things, but to copy the positive ones, it's always very difficult and tricky. So you have to be very intentional about this. If someone is speaking about something that you see that, oh, this is not in line with what I believe about myself and about this career, step away. It is better. Thank you very much for this aspect of the winner's mindset. If strangers blame nurses, we can understand. Oh, where's the chart? Sorry, I'm just reading along as we're going. You can understand. Oh, sorry. Yeah, yeah. How can this carpet breached? Okay, if strangers blame nurses, we can understand that they are just ignorant about the role of the nurse. But why is it that the highest opposition comes from medical doctors and times who sees nurses as a lesser set of citizens? That's frustrating, especially with the new nurses. Yes, Dr. Leo, that's something that is very, very important, and I'm going to be addressing this as well. right? So it is very important. And this has to do, again, I will just address it now, Dr. Liu, because, that is because from the origin of nursing, nurses have always been seen like assistants, because at the beginning, they were like from the lower class, outcast, and stuff like that. So that perception, that stereotype has moved even into this current generation. So it is not like a nurse is, so people still believe, and even the medical doctors, they still believe like nurses are their assistants, whereas those are just separate professions that come together for the common good of a patient. That's why we have laboratory technicians, we have nurses, we have healthcare assistants, we have the doctors themselves, we have specialists as well. What are we doing? Nobody is above anybody. There is no superiority here, although that is not the reality on ground. We are all coming together to work for the common good of the patient, right? So this is why we have to continuously advocate for ourselves and for our patients. Because if anybody tells you, and again, it all boils down to the way you present yourself as a nurse and how well you equip yourself for the nursing journey. This is very important. If you come in as someone who always waits for instruction, someone who is unable to even understand the basics of something, or someone who is always like, yes, sir, yes, sir, I tell you, that is how you'll be treated. I'm not saying this to cause any conflict among different professionals, but this is the reality on ground. Take, for example, I really love doing spine surgeries. And now I've actually, when I just started before, I was like, okay, I'll just pass instruments. But before a procedure, before my list the next day, I read on the procedures. If there are not procedures I've performed before, I'll be like, okay, how is this done? So I read to understand the anatomy of the patient, where they are operating on. I will know if it's a lumbar spine or are we doing the cervical spine. If I know that it's a cervical spine, okay, I know what I'm expecting from there. I am trying to understand that pathology itself, how it came about, so that when I am giving those instruments, and I'm not just handing over instruments to the surgeon, but I am also being able to participate, understand what is going on there, and being able to anticipate the next step. Because if I know what the procedure is, I will likely be able to anticipate the next step. But take, for example, if you're a nurse where you just say, okay, this is a job I'm doing, and you just come there and stand, you don't understand the anatomy, you don't understand that condition you are trying to perform the surgery because, then you're just passing instruments, or maybe you don't even know the instrument. Tell me, how will you present yourself? How is it going to be for yourself? It's going to kill your confidence, because sometimes how competent you are and how knowledgeable you are regarding a certain topic helps you to boost your confidence. But just because you're not aware about what is happening, you're completely disconnected. At the end of the day, you end up, even what you need to call out, you'll not be able to call out. Why? Because you yourself, you don't know. You've not prepared yourself for that thing. So it's also important that as much as we are trying to break the stereotype and make it be known that we are all separate professionals coming together, we also need to equip ourselves, be strong advocates, not just for our patients, but for ourselves, be able to speak up, be able to learn and evolve, be able to engage in continuous professional development, events like this and conferences, so that you can always be up to date with the knowledge that you need, and also be up to date with current practice, so that when somebody is saying this, and again, standing up for yourself also comes, it can also come in a sense where you're correcting somebody respectfully, because sometimes somebody might say, oh, this is what the patient wants, or because you're spending so much time with the patient and you're like, no, I think this patient's BP was this yesterday, so I think this could be this. If you're able to contribute like that, that's fine. But if somebody tells you, okay, do this, and you're just going to do it without even thinking, right? Knowing the rationale and understanding why you're doing it, it helps you a lot, so that you are participating. And that alone, it also applies to different things. And again, I'm going to speak about teamwork, but because we are already talking about this, I would like to mention that this also helps when you're working within the team. If you're within a team and you're constantly that person who is always at the side, not contributing, not asking questions, not taking initiatives on your own, how would the other team members see you? They will see you like a burden. That is just the truth. No matter how we try to coil it or make it look good, they will always see you as a burden. So if you are not contributing, be doing something, take the lead in some way, there will always be something that you can do. There will always be a way that you can intervene. But if you're not doing any of those things, tell me, how would they see you? And how will you even be able to step up and say, no, this is not right? It will be difficult for you to even do the advocacy that we all have to do for the patient and for ourselves. So it is also very important. Thank you so much, Dr. Liu, for that comment. I really do appreciate it. Yeah, so it is very important that we make sure that at all times we are seeing ourselves as a valuable member of our team. It doesn't matter, even if you're a student, let me tell you this thing, even if you're a student, your presence in a place should be valuable. You don't need to know everything. You can never know everything to be a positive contribution. No, get that clean and clear. You can never know everything. You don't need to know everything before you're a positive contribution to your team. So don't say, oh, because I'm a student nurse, I'll wait until when maybe I've finished my graduation and now I'm into the field and I'll see what to do about it. No, the best time is now. Find a way, plan it, think about it. What do I want for myself? Where do I want to be? What do I want to achieve in this career that I'm building? And how do I want to do it? How do I want to present myself at the end of the day? You know what? When I'm going to work every day, I am going like somebody who loves my job. I'm going like somebody who is ready to contribute to patients' well-being. I am going like somebody who is ready to support my colleagues. That is how I leave my house every day going to work. So that should be the enthusiasm. And again, if you are able to have this settled before you even start your job, I tell you, you know how quickly people burn out when it comes to nursing. You will not burn out easily. I tell you, this is a secret that you should know. The way you prepare yourself before you get into real world nursing will determine how well you will be able to stay in it, grow in it without burning out. It all goes back to you as a person, how you see it, how you take it, and how you respond to things. It matters a lot in nursing, because I tell you, there'll be good days, there'll be bad days, there'll be days where you feel like, oh, today I am so blessed, I love this job, I can do this every day. But there are other days where you be like, no, this is not for me, I don't want it anymore. So you need to know these things ahead of time. I think the other time I was speaking to one of my colleagues and he was like, oh, you're so hard, it's so difficult to annoy you. I'm like, I come here operating from a different frequency. I don't let that happen, not because I'm the strongest person, but because I know what I want for myself. And when I'm coming here, I'm not coming here for anybody. I'm coming here for the patient and for myself. That is just the truth. So anything that I'm doing will be centered around those things. So that is the kind of thing, those are the kind of preparations that you're preparing yourself ahead of time. So that when you get into it, you're not just trying to find your way again and falling for everything. You have your grounds already rooted. So you know what you want. It is very important. I'm really insisting on this point of knowing what you want, because at the end of the day, we will turn to, a lot of people do turn to go and start doing something because they just feel like, okay, I didn't plan anyway, so I'm just taking anything you're accepting, or any opportunities you're welcoming. It should be because it is a temporary thing, or it is connected to where you want to be. Or if it is not connected, at least you should know that this is just for now. And again, I have a greater goal that I'm working towards. And so I will not be distracted. Whatsoever it is at the moment, I am not distracted. If it is not as beautiful as I want it to be, I am not distracted. I know where I am going to, and I am ready as an individual to put in the possible effort and everything I have to make it work. Right. So from there, now I want to talk a bit about nursing and technology, and AI, I will touch a little bit on that. And before I go on to talk about nursing and technology, I am so excited with the way things are evolving. If you are someone who is keeping up to how digital things are getting, you will tell me that it is so exciting. The other day I was reading a post where somebody, his that is his mom, actually was able to spot issues with their heart. I can't remember the exact post anymore, because they had a smartwatch that could actually monitor and see that, oh, there was an irregularity. So that is the beauty of the digital aspect of nursing. So again, when we talk about this topic, it looks like something that is very far. But if you look at it, between, I think, from 2023 up to today, we see a lot of things have evolved. A lot of things are changing. And again, we have to embrace this change because it has come to stay. I know that it can vary between regions, between countries. There are some places that will be able to quickly adapt, while others will take a bit of time, because again, we are still, hello, Pastor Zion, thank you for joining. I really do appreciate. So there are a lot of things that we are still trying to catch up with, especially for us, like in Cameroon. There are a lot of things we are still trying to catch up with. But I tell you, this digital thing and technology has come to stay. There is no way we can take it away. We are here for it, and it is here for us. Because again, it is not just here to replace us, as a lot of people do believe. It is here to make our work easy. Say, for example, if you're someone who constantly does the paperwork, writing patients' notes, imagine now that you're able to just do it electronically. So you're not too focused on trying to figure out what to write, but you have something that you can just quickly put in. And again, it's saving your time. It's helping you so that you're not missing out on important information. And again, it's helping that continuity of care. Because at the end of the day, the papers can get missing, but what is stored online or electronically, you can always retrieve that data, you know. So that is the beauty of technology. And again, looking at AI, it is something that it is so, so good. And I can see, and I'm so excited with the way a lot of nurses are taking advantage of this AI in nursing thing. The other time I was speaking to one nurse who actually was a bedside nurse, and then she finally joined an AI company, and they are doing amazingly great. Like they're doing so much in nursing, and I can see that in the next couple of years, maybe 5 to 10 years, there will be a lot of changes, right? And let me tell you, if you look at the flyer for this event, the first flyer that I designed for this event in 2023, it took me a couple of hours to get that design done, because I loved graphic designing. Because again, I just love doing my own flyers by myself and doing little things. So when I learned graphic design, I was like, okay, I want to really get to do my own stuff by myself. So that design, it took me a couple of hours to get it done, right? But I tell you, when I was ready for this next one, and again, I had to now include Stanley on the flyer, I just gave AI a prompt and they designed me that same flyer. So I didn't sit there for the couple of hours that I previously sat down just to make the old flyer. In short, I will drop it in the group later on, right? You can see it. I just told AI different things to just include and think different things to exclude, and it gave me that beautiful design. So that's to show that maybe the 3 hours or 4 hours I would have been there trying to design this and pick this here, at least my background knowledge that I had on graphic designing and what I wanted to see, it helped me. So I was given a good prompt, right? And this is why I will speak a bit more about prompt engineering, because again, it's all connected to nursing and technology and stuff like that. So that is the beauty of it all. You're able to do a lot with it. Like just saving that time is so much you could have done. So think about your presence in a hospital or taking care of a patient. You're not just focused on only trying to write the paperwork, because again, we are so intentional about the paperwork thing. It helps for continuity of care, and it also serves as a legal backing for us in case anything goes wrong, you know. But if you're able to do that swiftly, it means you can focus a bit more on your patient and you're providing the care, and it's also saving you a lot of time, which is very, very important. Yeah. So let me say that this technology, if you have any way, and again, there are a lot of people that are getting into telehealth nursing, and which is so lovely, I tell you. That's why you see this aspect of saying that there are no opportunities in nursing. Yeah. You need to clean that off your mind today, because there are a lot of opportunities. There are lots and lots of opportunities, regardless of where you are. You know, it doesn't matter where you are. You just need to strategically position yourself for it. There are people that are just writing, they are just copywriters. So they are writing for different companies. There are others that are just helping different companies to just schedule meetings with patients. That's all. Those are a lot of things that you can actually do as even a side. If you're someone who love bedside nursing, because there are a lot of people who really love working in hospitals, like genuinely do. So you can even have that as a side thing that you are doing. It is possible. So I'm just trying to make you understand that with the digital thing in nursing and technology, it has only come to make our work better and easier for us. And it is a tool. If you use it properly, it will help you. But if you're unable to use it properly, what will happen? You will end up draining the remaining knowledge that you have. And this leads me now to the topic I wanted to talk on: prompt engineering. Just a bit of it, because this is a big topic on its own. So, a lot of people do use AI, different like Grok, ChatGPT, different thing, Gemini, and different thing. But there are people who, depending on how you prompt it, AI is not as intelligent as the human brain, first and foremost, and it can never replace a human brain, right? So when you look at it, so when you look at it, there's one thing that you need to note. The way you prompt AI, that's definitely how it's going to respond to you, right? That's definitely how it's going to respond to you. So you need to give it information. That's why the more knowledge you have on a particular topic, the better you are able to prompt it. So it is just a tool that is going to enhance your work and make it better. It has not come to give you. So if you ask it anything, it will give you, it will always have an answer to give you. But the question is that answer relevant? Is that answer evidence based? Is that answer something that you can actually say, oh, this makes sense, and read it like a human being and say, oh, this really makes sense? So these are the kind of things you need to consider whenever you want to prompt AI, no matter what. Okay, just let me know. Is there any AI tool you're currently using so that we can have this topic completed? Yeah. If there's any AI tool you're currently using, just drop it in the comment section so that we can discuss a bit more about that. Yeah. So it is very important. So, for example, if I'm asking it to do something for me, I need to be specific. Regarding the flyer, like I was saying, what did I say? Oh, okay, Chifana, you use ChatGPT. So you can actually personalize ChatGPT, right? I think a bit more, I'm going to drop more about that in our group because it's just a lot. There's a way you can personalize it and use it as your assistant based on what you want to focus on. And you always give you responses based on that, right? Some of the technology only ends in towns and cities. What are the options for villages? Yeah, like thank you, Zion. Like I was saying, some of these technologies cannot, every place cannot adapt to it as quickly as possible. We just have to keep managing with what we have until when it reaches us, because there's nothing we can do about some of those things. We can't just change everything all at once. But the truth is, no matter how long it takes to come, it will definitely come because it is making things even much more easier and better for all of us, right? Yeah. So the way you prompt it, don't ask it a direct question. Don't say, what is this? Bring your idea to it. Let it be to make it, to refine it. Let your end goal using this tool should be to refine your work. Let it not be like it is replacing you. Because at the end of the day, if you depend so much on the tools, what will happen? You will not even be able to think critically again. And critical thinking, it's a very, very important blessing that we have from God. If you're unable to think critically as a person, I tell you, at the end of the day, you will struggle a lot because those tools, they will tell you options, they will always have an answer, but you have to still use your brainstorming ability and your ability to think critically. Then you can be able to come up with very up to date information, right? So because of our network issues, I will just let Stanley go ahead with the session he has, and I will note every comment in the comment section. And after his presentation, then I will carry on by answering those questions first. Stanley, over to you. Are you there, Stanley? Mm, I don't know. I think I lost. Okay. Sorry, everyone. It's just because of the network issues, but I will just write on. Dr. Liu, I've noted your question. Yes, so I'm going to answer. I'm going to respond to it soon. Thank you. So, because of the network issues, the next thing I want to talk about is workplace excellence. It is not, no matter how knowledgeable you are, no matter how skillful you are, if you're unable to, number one, relate with people. Talking about us nurses, we do relate with people a lot on a daily basis, be it our colleagues, be it members of our team, or be it maybe our senior managers, or maybe the patient's relatives. Okay, Stanley, yeah, you go on. You go on.
Okay. Can you
Yeah, I can hear
can you
you.
can you get me, please?
Yeah, I can hear you. You go on.
Okay, thank you very much for the Yeah, apologies for breaks. Once more, it's a pleasure to be on board, to share, to learn, to inspire, and to aspire because we all are learning. You understand? And from all you've shared, it's really incredible. And I believe that those of us who are here, we are taking down notes because this is premium knowledge. Thing that we access math you get. So there is use politics but in planning professional journeys is all about distinguishing yourself by taking the road less traveled. And tonight I'm going to be talking about how to position yourself in the job market as a nurse, Yeah, in a time where competition is something that is inevitable, and for you to be able to surpass that. Uh, hello.
Yeah, we can hear you, Stanley.
Okay, like I was saying, we are in a time where competition is becoming more and more intense, and for us to be able to position ourselves and take advantage of the bigger opportunities that we have, we must be able to build ourselves. We must be able to be visible, and to be visible, you cannot be visible without competence. And to be competent, you need to be able to acquire knowledge. And acquiring knowledge is about coming to rooms like this where you take or you learn from people who have the experience, who have traveled the lane that you want to walk in. And like you rightly said, uh, technology is making the work of nursing easier. And in the same vein, technology has come to make you more visible, to make your opportunities that you want to achieve or to gain more easier to get them. Just like you said, AI, ChatGPT, Gemini, Cloud, all of these tools, they have a way they can play in making you stand out, in making you visible into the world. Because when we talk about positioning, we are making sure we are visible in the eyes of those who have the power to give us that influence, give us that push. And for you to be able to have that push, you need to do things that can attract these people, that can make them trust you. Just like for us, who is competent, he's going to sit with king as a king, not as a mere person. So in the journey of job positioning, as a nurse, as a nursing student, it starts first with one currency, which is your relationships. And I always tell my friends, I always tell lots of colleagues that your internship is not just a school prerequisite that you want to go and fulfill. That is something that you have to do with passion. You have to do with commitment because that is already a professional profile you're building. That nurse you are working with in the ward, that lecturer you're interacting with in the classroom, that is your potential employer. That is your potential collaborator in a project that can change your life, that can make your life better. So you need to take every aspect of your journey seriously. So you don't need to judge your relationship because relationship this time around are currencies. It shows that relationship they they have a higher chances of getting jobs, opportunities than people who are just intelligent. To say that being intelligent is not enough. You need to have a backing. And this relationship is not what we mostly know in our African continent, where you have to go pay somebody or you need to bribe. No, it's about somebody who can attest, someone who can recommend you. And for someone to recommend, the person must be able to be and must be able to justify that you are capable of doing this. So you need to take opportunities. You need to take your life seriously. Every second, every minute, every hour, every day, an opportunity for you to stand out from the rest of the other people. There are so many students, there are so many nurses that keep complaining about the system. Oh, hello?
We can hear you, Stanley. Right on.
Network.com connected to matters. Whoever you're connected to matters. I keep repeating this because there are times where you are a nurse and the most prominent people you are connected to are musicians. There are people who do not even have a direct influence on your profession, on your journey, but you want to grow, you want to be able to be spotlighted in platforms that talk about nursing. No, you need to connect with people. Now, the aspect of social media, the aspect of social media is still in line with technology. What are you using your social media for? What are you using your Facebook account, your Instagram, your LinkedIn? There are some people here who are still hearing about LinkedIn for the first time. Do you know about LinkedIn? Do you know that you can use Facebook to command authority, to command certain opportunities to come to you without leaving your house? So what are you doing with your social media? Are you there just to cash cruise? Are you there just to share memes? Or are you there just to click? Social media is a gold mine in the aspects of job positioning. There are people who will just look at you and will say, no, hey, I know this person from maybe Facebook, LinkedIn. I've been seeing this person talk about nursing, this person talking about health. I think we should reach out to this person because we want to run this project. Because whatever you share, whatever you say, whatever you continuously do, it gives an impression to the people. It's just like a reputation. It gives people this perspective about you. So what are you known for? Will people talk about you that you are a good nurse, or will people say, no, that is someone who loves sharing memes? We like going through social media feed just to find this person because he is good in comedy. Meanwhile, you're a nurse, so you do not have clarity. You do not have clarity. Thank you so much, Dr. Leonard. Discipline and consistency. So you need to consistently show up. You need to consistently tell people what you do. No matter what others are saying, because we are in the rate we do because that's it. For you to have clarity, you need to have your core values that you follow, because it is your integrity, it is your passion and your consistency that will take you to levels intelligence alone cannot take you to. And that aspects are about job positioning. People in nursing school, you'll be taught about this. It's
Yeah, so I will go ahead to first of all answer the question that Dr. Leo did drop in the comment section. Dr. Leo, regarding the aspect of mentorship and coaching in nursing, okay, I'll just answer the question, then I'll give Tanya the floor to continue. So regarding that aspect, right, the thing is, majority of the times, like you rightly said, students come into nursing with the expectation that the 3 years or the 4 years they have as for time to train, it's enough to prepare them for life after they've completed their studies, which is not true. Your training institution can never teach you everything. When it comes to being able to be excellent and to grow in your nursing career in the real world, you need more than just what you are being taught in your classroom, right? Because think about it. How many times, how many times do we have to actually practice what we learn? How many internships do we have in a year? How many times do we have those simulation sessions where they can actually say, okay, this is this, and you're actually touching and practicing, because it's not enough to stand back and just watch something being done. You also, when you do that hands-on practice, it helps that skill, to stick. And again, a skill, you improve on a skill, the more you practice it, the more you study about it, and the more you're able to do it consistently. So we lack the opportunities to have those, those simulation sessions, and even the knowledge that we do teach. There are things like workplace excellence. We don't get to learn them in school. Cultural intelligence, we don't learn them in school. Situational awareness, they don't teach us those things. Those are things that we have to go an extra mile to learn them. I tell you, even if you like it or not, if you like, you can hold on to your lecturers and blame your institution saying, oh, they didn't teach us this thing. We expected this, but we didn't have it at the end of the day. It's not going to help you. You need to come to a realization that all of the things that you are learning is just preparing you that, okay, this is it. This is a trainedness. But when it comes to your growth, when it comes to your ability to be able to perform excellently in the real world, you need yourself. And this is when the aspect of mentorship and coaching comes, Dr. Liu. Majority of the times you'll be like, we are expecting a formal session where we can actually sit in the classrooms, but being able to learn and unlearn and relearn new things, it's how well you are available to attend different conferences, different events, connect with different professionals. Because when you connect with different people, it's like, okay, this person, they learn differently. This is how they practice. These are the kind of things they do. That shapes your reasoning. And again, people are not ready. Majority of the nurses, they are not ready to pay for a session or to commit themselves to learn something new. They are just like, this is an extra burden, or I don't have time for this. But when it comes to mentorship and coaching and how well you can actually know and prepare yourself for real world nursing, I tell you, classroom is not enough, and it needs you as an individual to take up that step, that bold step to say, okay, every year I have this routine. In 2 months time, or in 6 months, or 2 times a year, I need to attend such a conference. I need to attend such an event. I need to study more on this. I need to watch simulation sessions. That is going to help you a lot, right? So that you'll not just be aiming for the certification. And again, another problem is a lot of people are not interested to learn about the skills and become better at it. The first thing they want is the certificate and the title. They just want to say, oh, I'm called a nurse. And they just want to say, oh, I have this BSc in nursing, which is not important. Because at the end of the day, no matter how well, no matter the number of certificates, if you're unable to offer the valuable services and offer it excellently and take care of your patients in an excellent way, there is no need for the certification, because anyone can have a certificate. But the difference now comes when you are able to use your certificate and the knowledge you've gained through the process of obtaining that certificate to make yourself a better nurse that can actually, that can actually be useful to your community and to the nurses, to your nurses, which are your colleagues, and also to the patients that you're looking after, right, Dr. Yo? So this follow-up thing is supposed to be, it's a personal responsibility. I tell you, it is in very few countries where they have this aspect of continuous professional development. For example, here in the UK, you do, once you're registered as a nurse and you start working, every year you have a number of, like, you have mandatory trainings that you need to go through them. You must go through them before you're able to work. There are trainings that expires after, in 12 months time you need to redo them. Others in 3 years time you need to redo them. So you're continuously improving on yourself. And there is this thing we call revalidation. When you're revalidating your registration with the NMC, there are a lot of reflections that you need to do. There are a lot of things you should have completed through your professional continuous professional development before they can say, okay, you are ready to continue being the nurse. If there is any question, if you cannot provide good evidence to show that you've been practicing according to the guidelines that has been established by the Nursing and Midwifery Council in the UK, there will be more information you need to provide. And if you're unable to provide that information, you might be suspended from the register. So that is to show that you're continuously improving on yourself. So you have those free opportunities to have that mentorship, by yourself. You're pushing yourself to learn other things. And take, for example, when you join like an association, for one, I've joined the Royal College of Nursing Association. They do have different coaching sessions that you can actually, some are free, some are paid for, that you can actually just get them into them and learn a lot of things. But at the end of the day, if you're not putting yourself out there as a nurse, especially if you don't have that luxury of having those free sessions through your nursing organization, nursing association, depending on where you are based, if you're not putting yourself out there to get better, at the end of the day, you will struggle a lot and it will make no difference, right? So again, it goes back to personal responsibility and the ability to recognize that whatever they are teaching you in school, it's not enough to prepare you for real world nursing, right? So I don't know if Stanley is back now.
Yeah,
Oh
yeah,
yeah,
I'm back.
Stanley, sorry, can you continue, please?
Yeah, okay. Apologies for that. For the breaks. Network here is really. Here.
The topic, the next aspect. Okay, Stanley, welcome back. Oh no. All right, so I'll
Uh,
just crack on then.
okay, okay. Just to make things easy, I would take the this model. This part of the model is not really based on myself. This can write. I get me next year. So
Yeah, I can hear you.
you can write on. You can write on. Yeah, yeah. I mean, I'm going to retake this particular aspect tomorrow.
Okay. Okay, that's cool.
The network is really stable. And
Aspect on our outline that I would like us to discuss more about is how to strive above average. You know, I love this aspect of how to strive above average. Why? Because we always have room for improvement, and on a daily basis, we have an opportunity to improve on ourselves, to improve on our skills, and again, to become better at what we are doing. So, striving above average will not just come automatically because of how much exposed you are. It is an intentional decision. And there is no way you can look at, or you can actually try to strive above average if you've not actually determined or established what average is to you. This is very important. You need to first of all know what average is to you before you can know that, okay, because this is average, I'm striving above average from here. If you're unable to establish that middle line, then you will not be able to know what you're working on and how you intend to go about it. And when it comes to how to strive above average, a lot of it will be centered around our work ethics, policies, and how well you're very, very like genuine to take care or to provide the services you're providing. Why do I say that? If you're striving above average without considering the work ethics, I tell you there is no grounds for your improvements. You need to first of all understand, okay, as a nurse, these are the things that I'm allowed to do. This is the way I'm allowed to this is how I need to present myself, because sometimes some things might be okay to do, but because of the way you want to present yourself and because of the way you see this career of yours, you decide to do it differently. Not because this is wrong, but because you see that, okay, although it's not right, although it's not wrong, but I choose not to do it. Right. So now you know what is average. You need to first of all know what is average. When it comes to your work ethics, what are the things as a nurse that you can never compromise? Right? How the personal values you have for yourself, what are some of these values that are shaping your nursing career? Because if you have your personal values and you're able to know that, okay, this is what I can do, these are the things I can compromise with, and these are the things that I cannot compromise with, that is going to help you to know that, okay, I am striving above average. Take for example, I for one, I hate being late. I hate being late. I tell you, whenever I'm late, when I feel like I'm getting late, I get so frustrated. So for the past couple of years, I cannot tell you, okay, I've been late for work. Why? Because timeliness is one of my values that I don't joke with. I prefer to sacrifice extra time, come and wait for something rather than coming later on and rushing to get it done. No, I don't. Even when it comes to work, I'm always sure that 20 minutes before time, I'm already ready, changed and ready, sitting in the coffee room and waiting for time to start my role. I don't want to be rushing up and down, because why? Timeliness is something that I take very personal. So what are some of the values, your personal values, that you know that with these values, I can never compromise them? This is something that it is not just a personal value, but it's a value that I'm also bringing into my career, and that will make you stand out. So that is you already knowing that this is what is average to me, and this is what you need to do. For example, I'm not here to say, oh, I'm criticizing anything or any trying to say different countries do permit different things when it comes to their nursing and nurses in general. But take, for example, having long lashes or having extended nails, like different things for infection prevention aspect of it is first of all not right, because a lot of germs can hide in those nails and end up making it, a risk to you and the patient. And sometimes putting on jewelries can also be a deal. But if, for example, your institution where you work is not very particular about those things, you as an individual, what do you think? When you present yourself before your patients with all of those things, what are you thinking? How do you want them to see you on a daily basis? How do you want your patients to see you? Because at the end of the day, your first impression doesn't only matter when it comes to your personal life, it also matters when it comes to your patients, right? The therapeutic relationship that you want to build with your patient also depends on how you present yourself to that patient. And if you come like somebody that is just everywhere, your hair is all over the place, your lashes are all over the place, your earrings are all over the place, everything everywhere, tell me, how do you expect that patient to look at you as a professional or not? So those are the kind of things you need to consider when it comes to striving above average. Again, it goes back to how do you in turn to make a difference? Do you want to make a difference first and foremost? Right? When you've established this is average to me, do you really want to make a difference? Do you want to be a different nurse and not another nurse? So that when you're present, when you're there, at least somebody knows that this person is present. And when you are absent, your absence can easily be noticed. That is the kind of person you should strive to be, right? And you cannot do that if you've not been able to say that, okay, I am moving away from this. These things are good, but I choose not to do them because at all times, I want to present myself as a professional. I want to present myself as someone who knows what I am doing. I want to present myself as someone who can be trusted to do this job. So it is very important to always have that at the back of your mind, that the way what you establish in your mind about your career is going to determine how you respond to things, and it's also going to determine how you will present yourself to the public. And for example, if you're a student here, I tell you, majority of the times you can just be looking for, let me just have a C grade and validate this course. I just want to validate the course. But is that what you're looking for? Who are you reserving the A grades to? Are there some particular people that must have those A grades? I'm not trying to say that A grades are what you should be aiming for, right? The knowledge itself is important, but that is also a way of justifying that, okay, I was a focused nurse. Are you just someone who is just looking at trying to validate your courses and be like, okay, I've gone to the next class? Or are you someone who is actually intentional about having the A grades and about being standing out, right? So that among your peers, among your classmates, they can actually root for you. They can look at you and say, oh, even if everybody is failing this course, you see this person, they are going to validate the course. So you need to have that perception. And again, when it comes to these little things, when you start it early, you will see that you will work with it until when you are in a real world, right? So are you just there just to validate your courses? Are you there to be that person that your absence can be noticed? Your presence can also be noticed. If you're not there, people will be like, oh, I wish this person was in here. I wish she was here for this presentation. It would have been beautiful. I wish she was here. She would have given us good ideas. So don't just go anywhere you find yourself. It is an opportunity to be recognized. It is an opportunity to contribute. It is an opportunity to strategically position yourself, because even related to the topic that Stanley was about to talk about when it comes to relationships, the perception people have about you will directly influence how well they want to vouch for you. If you're always presenting yourself like that person that person that is careless about everything, I tell you, there will come a time where you will need somebody to just vouch for you and say, okay, I trust Kendria, she can do this thing, I am vouching for her. They will not do it for you, because again, they are putting their credibility at stake. What if you get there and you're unable to perform? So it goes back to that. So that perception you're living in the minds of your classmates. You might think, oh, they are just your classmates. After this, we'll separate. I tell you, there is a way that you guys can easily reconnect. And there is a way that the more you do those things, there is this thing we call hypnotic rhythm. Nature, once you keep doing the same thing over and over, it becomes second nature to you. And nature will make sure that it is reinforcing that particular thing. So if you're somebody who feels like, oh, I'm a no nonsense person because I don't have any PIN or any license number that I'm protecting. So, anyways, it's all down to the nurse that is there. Or maybe if you're asked to do this, you decide to cut corners and do it halfway or leave the rest. Or especially when it comes to cleaning, you just clean what is visible and then you leave the rest. Or you don't even go as much as cleaning. You just sign the register and be like, you've done it. Again, you might feel like nobody's watching, but you are reinforcing a habit that you will keep reinforcing as you're working. So at the end of the day, it's not who is watching at you. Always act as if there is a great audience watching at you, and not watching at you to criticize you, but watching at you to applaud you and actually learn from you. And if you have that mindset at all times, you'll be trying to do your best and to stand out. 10 people can stand out. It shouldn't always be one person standing out. We all on this Zoom call, we can stand out, and it will even make things beautiful, and it will make our career, our profession to be recognized and celebrated. So it shouldn't be individual. It shouldn't be one person out of 10 people. We can all make something beautiful. We can all stand out. And that will not only benefit us, it will benefit our patients, it will benefit our profession, and it will make other people to see and to look at us as those that are actually valuable to the community. We'll not just be like, oh, now that needs that. No, that perception, we need to change it. And if we expect that perception to change, we need to take the action. We can't expect authority or different people to come in and do it for us. There's no way they can do it for us, right? So this aspect of striving above average is very important. And the next thing that I want to talk about under this aspect is workplace excellence. You see, majority of the times we are just focused on what we can learn, on the skills we can provide as nurses. But you see, this aspect of workplace excellence, it is very, very crucial when it comes to your career growth. The way you present yourself among your team, it's very important. Again, it sounds like a repetition, but it's in a different light. You see, when you say, okay, this person, you're in charge of this, and at the end of the day, everything about that thing is not done. You are printing an image about yourself. Unknowingly, right? They might not tell you directly that, oh, this is it, but behind the scene, they will be like, there are things that they will never recommend you about. A couple of years, like 3 years ago, I was speaking to one nurse, and she was like, no, she was not the nurse. Her sister is a nurse. And she was like, her sister goes to work late all the time and she doesn't care. So, according to her, the way she was presenting it to me, she made me to understand that because they need her services, so when she comes late, they don't care, they don't say anything about it, and it has become like a second nature to her. Anytime she shows up, she shows up. And then I asked her a question: how long has your sister been working there? She told me the number of years. I said, what level is she at? She told me, and I told her, you see that thing that she keeps doing and feels like, and other things, in short, I'm just cutting it short, and other things she was naming. And when somebody is trying to normalize something that is not appropriate, and making it to show as if, okay, because I'm able to do it means nothing is wrong about it. And then I asked her, you see that particular aspect that she keeps presenting herself that way, counter out of any promotions. When it comes to promotion, forget about it. And then when I said that to her, she sat back and she reflected. It just came back to her mind, like a lot of things replayed. And when we continued the discussion, she had realized herself that actually the length of time that she had been in that place, she was already should have been recommended for promotion, but nobody would do that. Why? Because you have regularly shown yourself as somebody that cannot be trusted. You've proven yourself to be like somebody that cannot take other responsibility. Because if you're unable to, perform what you have to do, then you don't expect anybody to promote you, because promotion comes with added responsibility. So if you have one thing and you're unable to control that one thing, how do you expect people to add 5 more to it? It is not possible. So these are the kind of things that we have to take into consideration. You might just say, okay, this thing, they don't care about it. It's okay. I will just do as I want. But ask yourself, will you ever be recommended for promotion? If something goes wrong, will people be able to stand behind you and say, oh, I think this is not you, or something about that? These are the things that you always have to take into consideration. Don't just do anyhow because nobody cares, because truly people are watching. Have this at the back of your mind. No matter how people try to say, it's okay, don't worry about it. They care about it. I tell you, they care about it. If you do it once, it's fine. Twice, it's fine. The third time, they start taking note. Before you know it, majority of the times they will not recommend you. And again, it goes back to when we have the opportunities to go for internships. Please use that time as an opportunity to showcase and establish your authority in the minds of your colleagues, in the minds of your senior colleagues at work, your classmates, and even the management, the managers there. Don't joke about it, because there are people that they have 1 month or 6 weeks for internship and they only show up twice. Why? Because the first day you need to present yourself, and the last day because you have to be signed off. Don't join those kind of people. Be intentional. Let consider every day as a blessing to you, as another opportunity to make a difference in your life. There are a lot of people that will tell you, oh, don't worry about it, you always learn it later. But there are some things that if you don't get them right now, I tell you, for you to get them right later, it will take so much time. Right? And then the next thing under workplace excellence is cultural sensitivity, or cultural intelligence, as I will put it. Our world is changing, a lot of changes. And even if you're in Cameroon, let me take, for example, you're working somewhere like in Douala, you have people from Banso, you have people from Bambili, you have people from Whom, you have people from Com. You guys do not speak the same language. You don't have the same food, or maybe people from the the Francophone zone. You guys are really different people. They have different cultural backgrounds. They reason differently, they think differently, they do things differently, they eat differently. So that difference is already existing. So the way you would stand out and strive above average in this aspect is your ability to recognize and appreciate people's cultural differences without letting it weigh you down, and without letting it redefine your own cultural beliefs. Very important. So you're not only there to say, oh, this person is like this, and trying to adapt to their own ways of doing things. No, you're recognizing their own ways of doing things, acknowledging them, celebrating them, but again, holding on to your own beliefs. This is very, very important, because majority of the times people turn, in the course of trying to understand and adapt or say, okay, this is how this person does it. They end up copying what they are doing and forgetting what is actually very dear to them. No, you're trying to strike a balance between it. So you're appreciating that person from band. So they are reasoning differently. They speak differently. This is how they talk. This is how they act. Then you, that you're from Babylon, okay, I know this is how I am. So you are making sure that you all are dwelling, are working together as a team without any conflict, when it comes to your beliefs, without any conflict when it comes to recognizing that, oh, this person eats this, but I don't eat this. So this is very important. And again, if you're someone who intends to move abroad, it is even more critical. Why? Because now you're not only dealing with people from the same region, from different regions in the same country, you're dealing with people from different continents, different countries, Asians, Indians, Americans, British, Canadians. So it is so much. And I tell you, the differences are a lot. The differences are so much. Sometimes you might just even ask yourself, oh, okay, there is something that for example, somebody will say something and it's so, so funny to them and they'll be laughing about it. But to you, it's not even funny. You don't even see any fun in it. That is just the differences that you guys have because, we do have our own things that can actually make us laugh, things that are funny to us. But to them, they might not see it like that. Others, sometimes you might make silly jokes and think that, oh, this joke is just okay. But to them, it's a big deal. Right. And if you're unable to recognize those cultural differences, you will always end up being in trouble. You always have to face the disciplinary council because you said something or you behaved in a way thinking that, oh, this way was appropriate, whereas it was inappropriate to others. For example, there are people from different African countries where we are okay to gist and touch and, laugh and clap hands and touch people and or say hello, kind of. But with some cultures, you don't have to do that. So if you're not able to recognize that the cultural difference is something that you need to learn, cultural intelligence is something that you need to learn. At the end of the day, you will struggle and you keep putting yourself in trouble and you'll be unable to adapt and work with people from different places. So this aspect of cultural intelligence, it's very important. And it also links to situational awareness. You see, situational awareness in nursing, it's a skill that you cannot learn it in one go. You improve on it on a daily basis. Why? Because situations are different and it applies in different ways. Situational awareness can also come between you and your colleagues, you and your patients, your patient, and your family members. Say, for example, if you're walking into a ward in the morning, and maybe you see a patient, let me say the patient is crying, and you enter there and you start making some jokes, or you just enter and you see a place quiet, and instead of you to just read the room and be actually trying to figure out, okay, what is happening, how can I come in, how can I stay, you just say something, you've just escalated the whole thing and you've made things even worse. So with situational awareness, you're trying to make sure that you are aware of the situation, you're able to read the room within 5 seconds and know that, okay, this is how I need to behave now. This is what I need to say. This is what I don't need to say. This is how I need to approach this situation. It is very important because situations can never be the same. Two patients might have the same condition, but some are responding different. Take, for example, a patient we can have the same cut, but one person, because of their ability to resist pain, somebody might be screaming and finding it very difficult to cope with that because they are very sensitive, but another person is just lying there and it's okay, they are able to just hold it, right? Then take, for example, if you just come in and that person is screaming and you be like, not only that small pain when they cry, so, and it is very common for people to say that, I tell you, you've spoiled everything. Why? At least you need to recognize it and say, okay, in this situation, how do I need to behave? How do I need to address this? What can I do to make this patient feel a bit more comfortable? It is very important. And then when it comes to your colleagues, maybe you can be stepping into the room or maybe into the ward or maybe into the coffee room and you see your colleague saying something or discussing or maybe something is happening. When you just enter, you need to read the room and know, am I supposed to talk? What can I say? Should I keep quiet for a few minutes and just see what they're talking about before I can jump into the conversation? If you just come in and you just jump and you start talking, you don't know what they're talking about. At the end of the day, you will say something that will put you in trouble. This is very important if you intend to move abroad. This is a very, very, very important skill that you need to be always aware of. You don't just jump into conversations the way you feel like you're feeling free with everybody. You need to always remember at all times that a professional environment is completely different from a personal environment. The way you interact with your friends, your brothers, your sisters, the way you crack jokes around, when it comes to the professional environment, you have to be professional. Sometimes it can get very friendly when you're working with a good team. Everybody is so happy, you crack jokes, you share things, but please never forget that a professional environment remains a professional environment. Do not get too comfortable with a professional environment. Even if the patient tells you, oh, you're the best nurse, you are this or you are that, please never forget a professional environment remains a professional environment. Even if you have a colleague that shares everything with you, you guys discuss a lot about personal life and stuff, please, a professional environment remains a professional environment. There is no way you can talk about striving above average if you're unable to distinguish between a professional environment and a personal environment. Why? Because some of the decisions that you will make will depend on those things. If you know that this is a professional environment, you know this is the limit you can go. You cannot exceed this limit. A lot of times we can say something, our friends will be happy with it, or maybe they can call us later to say, oh, Kendria, you see this thing you said was not really nice, and they can just let it slide. But in a professional environment, it is never like that. And again, we are dealing with human beings, and human beings, when it comes to aspects that are emotional things, it is very, very sensitive. And you have to be careful about those things, what you say, how you respond, how quick you are. Sometimes you just need to give yourself a break, or maybe a conversation is going on, or you have to say something. Please give yourself a break. Say it to your mind. I, for one, when I face a difficult situation, for example, like for us, we do work in theaters on a daily basis. We do have people that are in charge of the theaters. We do call them practitioner in charge. And throughout those days, you need to have a constant communication with the surgeons, with your team leader, with your colleagues. If maybe you need to send for a patient to come, or if there is a change to your list, a lot of communication takes place and a lot of negotiation takes place. And sometimes, because we have different personalities, someone might say something to you and you'll be like, you can respond in a negative way, or you might say something and end up saying that thing was not actually the way you looked at it. So sometimes I do say those things in my mind like 5 times before I say them out, especially when it's a difficult thing to address. I just repeat it in my mind, because if you repeat it to your mind, I tell you, if it's something that is rude or if it's something that is not well aligned, your mind will reject it. So get to a habit where you can actually speak to yourself, especially if you're faced with a difficult situation. Say it in your mind like 5 times. If your mind is settled with it, go ahead. Don't just be somebody that is responsive in one go. Sometimes you just need to take a break, step back. Don't try to always be the right person, please. This is very important, because we nurses, we are the highest people facing professionals on a daily basis when it comes to healthcare. We face patients, we face doctors, we face their families. So we have to be very conscious and very, very intentional about the way we address things. And again, this will also go to conflict management. As long as we are dealing with people, we always have conflicts. There will always be a day that somebody will annoy you. There will always be a day that somebody will say something to you that will make you feel like, oh my God, I just want to respond to this. It happens a lot, especially if you work in a high pressure environment. I tell you, if you work in a high pressure environment, your patience will grow as if you're not very careful. If you're unable to be patient, you end up every now and then you pick things. And the bad thing about all of those things is it will end up influencing your own mental health and your emotional well-being, because you end up carrying a lot of things, whereas those things are not the way they are. So this goes back to situational awareness. Think about it. Is this person responding to me this way? Is it because of the pressure? I'm not trying to normalize any rude or unprofessional behavior, but sometimes you also have to be critical about the way we look at some things. Think about it. If there was no pressure involved, would this person still behave this way? How many times, for how long has this been going on? Right? Think about those examples before you can draw a conclusion. Because if you're so quick to respond to everything, at the end of the day, you will make meaning out of everything. and you end up having problems with every nurse, every doctor. You'll be like, oh, this person, you see the person, me, I know the go. You see the person, me, I know the go, which is a very bad thing, because at the end of the day, whether you like it or not, you will still work with people. There's no way you can escape it. So it is very important that you try as much as you can to consciously always be present in a place. If you feel like this is just too much for you, step out. Don't try to say something. If it's difficult for you to process, step back and try to find out. Take, for example, there was a day that we had a very difficult case and we were trying to like work things out, and we had a very quick turnover. And one of the nurses, I did ask her, was signing done, kind of, because sometimes signing is done in the anesthetic room, and only those that are allowed to be in the anesthetic room can be in the anesthetic room at that point. So when I asked her, has signing been done? Because I need to fill in the patient's record. She responded, yes, in a very funny way, in a very funny way. And because of where she comes from, her voice is naturally a bit loud. So at that point, I felt like, oh my God, this was very rude. And then I stood back like a human being, any human being will start thinking, I was like, this is very rude. I need to address this. And I'm thinking. Again, I was telling me in myself, within my mind, I was like, okay, Kendria, you know what? Calm down. It is not what you think. And then within the first 5 minutes that thing happened, I began to recall, has this ever happened before? No, we've been working for a long time and this has not happened before. Again, we had a quick turnover. So everybody was trying to like do something quickly and make sure that we finish our list at the end of the day. And then I asked again, is it that because of her voice, did that also influence the way that thing was put out there? And I said yes. So I had that quick discussion in my mind. I'm like, okay, I need to let this slide. Had it been I had previously noted that, it would have been a strong point. If it's someone that has a calm voice naturally and said that thing, I would have been like, okay, this is very loud and rude. This is something I need to address. But take, for example, if I was so quick to say, why are you rude to me? Or just address it right there, I will be wrong, because there is a lot just going on. So that is an aspect of emotional intelligence that we need to learn. And it also relates back to situational awareness. I know that this is high pressure time. We are trying to rush. She's putting on a mask and trying to make me hear what she's saying. She naturally has a loud voice. So those are the kind of things that where I had to put into consideration and came to a compromise that, okay, see what, this thing is not a big deal. So this is something that we also have to do on a daily basis, because we will always meet people. Your colleagues, sometimes the matron in the wards, you might feel like, because people have this perception that you see the matron is a difficult person to deal with, but that is not true. Sometimes it could just be because there is just a lot going on their tables. I'm not trying to say everybody's a nice person, but protect your own energy, protect your own self, create your own boundaries for yourself, not for anybody. The first person you should be protecting is you, and you cannot protect yourself without establishing what you let into your space and what you don't let to get into your space, right? So I hope this particular aspect, I'm really reiterating about this aspect, because we are in a people facing profession. Even if you don't face people in hospitals, you will face people in a community. So at all times, we are relating with people, and being able to relate with people is a very important skill that we have to continuously learn. Please do let me know if you have any questions or any worries, anything, just drop it in the comment section, and I will check the comment section as we progress, and I will respond to your questions. Yeah. So the next thing that I love us to talk about today is how to use your superpower to build and to stand out with it. We all have a superpower. You might be wondering, what is your superpower? That's something that you do effortlessly. That is something that is just a thing to you that you are so good at it. It's not like a skill, right? Something natural about you that you are so good at it. You can capitalize on that and make your career beautiful. Have you noticed that there are some people that when they step into the ward, just their presence, the way they talk, the way they communicate with the patients, you'll be like, oh wow, this is really beautiful. There are some people that once they come into the room, the way they just smile at every patient, everything is just going. There are others that they are able to grasp information quickly and learn skills quickly. That is just their superpower. That is something that they don't do it with. They don't need effort to do it. But because that is how they are, they turn to just do it naturally. So, what is your own superpower? What is that thing about you that is so natural to you that you don't need effort to do it? Is it your smile? Is it the way you communicate? Is it the way you write? Is it how quick you're able to pick things up? Is it how quick you're able to, understand concepts? That is something you can capitalize on. You might be wondering, so how does this apply to your career? It applies a lot. When you capitalize on the things that are very that are very beautiful about yourself, every other thing falls in place, follows behind it. But if you're so focused on what is wrong about you or what is not perfect about you, you will end up pushing yourself towards the negative edge, right? But if you know that, oh, this thing, I do love it. When I speak to patients, they are able to understand me. The way I just crack jokes with them, like constructive jokes, anyways, the room just feels very friendly, and that is how I am. We all have one. It's only because you've not recognized it. There is something about you that is so special to you. You don't need effort to do it. If they wake you up 5 a.m. in the morning, you will do it. You will say it. In short, that is just nature to you. So you need to capitalize on that. That is what makes you a differentness and not anotherness. That is what makes you you. That is something that when you bring to the table, it makes the difference between you and someone else. So, what is your superpower? And in case you've discovered yours, or you know that this is the thing that when I do it, when I say it, the way I talk or the way I behave, people turn to say, oh, this is really nice. I admire this about you. Drop it in the comment section. Just 1 minute for that exercise. If there's anything about you, be it the way you present things, the way you learn quickly, your classmates or your colleagues are always like, oh, this is good, this is beautiful. Drop it in the comment section. I'll be reading. Just two of them, then I'll carry on. The thing that you know that, oh, whenever you do it or how you do it, it could be the way you talk, the way you crack jokes, the way you smile, the way you write, something, my smile, the way I learn quickly, good. That is something you can capitalize on, because, sometimes things can get so tense in the hospital, and the way you bring in that smile, it just lighten up the whole place. Or maybe you could be taking care of a patient that is so anxious and so stressed, but the way you just smile at them, they feel like, oh, finally there is somebody that actually understands me, because you see a smile has a voice. If you've never known, your smile itself has a voice and it's always saying something. So if you have a smile, that is a very, very beautiful superpower to capitalize on. So that even no matter how difficult it gets, you are still smiling. And your colleagues will always feel your presence. They always feel that warm. Your patients will always feel that warm, which is a very, very important superpower. Thank you so much for sharing. Anyone else? Just one more and then we carry on. The way I communicate. Good, Agnes. That is so, so, so very important. For me, I just have a soft spirit. That is a superpower. From today, since you've actually openly recognized it, try to capitalize on it. Every time you step into a place or whenever you have an opportunity to do anything, think about that superpower and capitalize on it. The way you communicate, in it, again, communication is at the center of our career. There's no way you can be an excellent nurse where you cannot communicate your ideas, communicate with patients, hand over with your colleagues, discuss during assessment and different things. So if you're able to communicate in a particular way, that is a powerful superpower that you can use and it will help you to stand out in your career. Anyone else? And soft spirit, this soft spirit is something that you cannot hold, you cannot touch, but you can actually feel it. When you have somebody that you can commonly call it the soft spot, you have that soft spot. I tell you, a lot of people will reach out to you to say, oh, can you help me with this? Why? Because you know that they have that feeling that, oh, this person is soft spirited. So they will be able to address my situation. They'll be able to help me and I will not have to struggle with them. So you see that a lot of people, you will be able to get along with a lot of people because of that soft spirit of yours. Okay. Anyone else? Anyone else? Okay. If no one else, Then please do let me know if you have any questions, any more questions. I can answer them because I think for today we'll be rounding up shortly. Again, we've just had so much, we still have so much to talk about, but there is an important thing I want to talk about today because tomorrow we won't have so much time to discuss all of those things. So I have two more um, outlines to cover now, which is linking theory with practical and email writing. I just try to fit in this email writing because a lot of people previously reached out to me about this email thing and continuously their students and some nurses. So I'm like, okay, let me just add it to this event and just find a way to fit it in so that at least you can have a clue. It's not a complete my attitude of obedience. That's another superpower that you can capitalize on. Thank you so much for sharing. It is something that you can capitalize on. So now you see that we all have that thing that we can actually capitalize on. So every now and then have it at the back of your mind. This is something I am capitalizing on. This is a special thing about me that I'm going to capitalize on and I'm making my career beautiful. So thank you all for sharing. I really do appreciate that you guys have shared this. And again, it makes it very, very realistic, isn't it? So it's not something that is fictional. At least we can actually see that it's something that is practical, right? So the next thing I want to talk about is linking theory and practicals. And if you look at the 6 point framework of learning a new skill, you'll see that some of the things I'll be speaking here will help you to understand that framework well. Please, that framework, it doesn't matter what skill you want to learn, be it in hospitals, be it in school, whatever, that framework is going to help you. So please don't just keep those worksheets just for the purpose of it. Make sure you go through them and try to use them as much as you can. So when we talk about theory and practical, it's like your volume is low. Oh, really? Is it? So, like I said, the next topic we'll be talking about is linking theory and practical. The first things we always learn is the theoretical part of everything. Then we get into the practical. I'm talking about from a nursing perspective. There's no way you can start by practicing something without actually knowing what the thing is all about, right? Let's take, for example, like a skill like cannulation. You cannot just start practicing cannulation without knowing what to do, why you're doing it, how to do it, what you will do in the process, and how you prepare yourself for that process, right? So when it comes to linking theory and practical, you need to first of all know that sometimes the way the theory is explained, you will not practice it that way. I'm not trying to say that you're going away from it. If you're only focusing on the theory, and not being able to see that sometimes there could be a difference in practice, or the way you are expecting it to be, or the way you're visualizing it might be different, then you're going to struggle a bit more, so always know that the theory that you know, if you want to practice, put it into practice. What you should be looking at is to make sure that everything is safe and is for the good of the patients. Because the theory sometimes can just be too much and you come with too much expectation or not expecting it to be that way. And then at the end of the day, now you need to do it. Or sometimes you might feel like, okay, once I have the theory in my mind and I'm coming to practice, I just need to crack on directly with the practice. No, there are some aspects of the theoretical aspect of things that you must still implement them when you're practicing. Take, for example, like IV cannulation. If you know that, okay, the first thing you need to do is, you know that this is your patient, that you need to do the cannulation. You've already gained consent with the patient. You've checked your environment. You've sanitized your hands. You've prepared your tray for the process. And then now you do everything like prepare the patient's hand, check the vein which you want to access. And after you've checked the vein, you take off your tourniquet, you clean and all of that, because you already know the theory. Don't think that now when you come to practice, you just need to crack on and just go directly to get it. No, the theory is not just to prepare you to get into practice. It's something that you have to continuously do. So don't let your skill, the good practice slip off. Don't let the good practice fade away when you become an expert in it, because that is the risk. That is something that is very common, because now you know how to do it and you are no longer focused on following the whole process again.
I don't know. It's very common. If you've come across something like that, just let me know in the comments, right? Where you know that, oh, this is how I need to do it from the beginning, you'll focus on it. But when you start doing it in 3 months' time, in 6 months' time, you just go directly to it. You're not following that process. The process is there for a reason, especially if it has to do with direct patient contact or anything that is going into the patient. Please always follow the theory. The theory there should always be a link between the theory and the practical. Sometimes there might be a bit of a discrepancy between the two, but yeah, it is very, very common. If you're an expert, if you become an expert in something, your expertise should help you to do more. It should not further lower your standards or what you're standing for. Please, that is a very high risk thing that people end up falling for, right? So always follow instructions. If it says start with this, please start with this. If you need to introduce the patient first, introduce the patient. If they say cleaning starts with the top before you come to the bottom. Please don't just say, oh, this is theory, because majority of times people say that one not theory, forget that book. Forget that book. That one a book for year and practice. No, please. If it says that, it is for a reason. It is because it has been researched upon and has been seen as the best way of doing it. That is evidence-based practice in action. That's true. And sometimes we instantly leave out a process like clothing when we become expert. Exactly. Thank you for sharing that. Gloves are there to protect. It's for infection and prevention purposes, isn't it? To protect yourself and to protect your patient, right? So don't let your standards slip off. Don't say this one that theory. So the theory don't end, it ends at the level of the classroom, and now you've come to real world practice and you want to copy only the wrong things. I know it is very, very difficult, especially when you're a student and you're coming to the field, for internships, you have a matrons or senior colleagues telling you, oh, that one now in a classroom thing, don't bring it here, things like that. Please try as much as you can to hold on to your standards. Even if everybody decides to do it the other way around, still hold on to your standards. If you have to wear gloves, wear gloves. If you need to take off your gloves, take off your gloves. If you need to do this, do it that way. Don't fall for that thing, because again, they've been there for a long time, but you're just starting off. If you start off with the wrong things, tell me in the next 10 years what happens. It will only get worse. And again, there will be people coming that you need to teach them. So what will you be teaching them really? What will you be teaching them? I think there was a time where I was actually showing a student how to scrub when you're getting ready for a procedure. So when he scrubbed the first time, he touched the environment. So his hands touched the soap dispenser. So again, he had to rescrub. So he told me, oh my God, Ness, this thing is so difficult. I'm like, I totally understand that it is difficult, but it is not for you. It is not for the purpose of being difficult or easy to do. It is for the purpose of patient safety. So you don't need to do it because it's easy. You don't need to do it because you feel comfortable doing it. Sometimes you're doing it because it is safe. And if it is safe, you need to do it. Right? So please don't let your standard slip. I'm really saying this because, again, I'm mostly talking my audience today is students and newly qualified nurses. We have a lot that we are coming with into the field, very fresh, knowledgeable, ready to kick, to crack on. But when you come and be like, no, that one I have on a book, or you see people doing something and you know deep inside of you, this is not the right thing to do. But because now you're just comfortable with it, you will do it today and say, okay, let me just do it today. Before you know, it becomes like second nature to you. And the more you practice it, the more you become used to it. And again, you will not see any problems with it. The first time you might do it and be like, okay, I will do it today, and tomorrow I will not do it again. Tomorrow you will do it again. The next tomorrow you do it again. And after some time, you will not see any problem in it again. So that is the risk. Please, theory is important to help you practice. Whatever you're practicing, make sure that you understand the theory behind it. You understand the rationale for doing it. Don't just be a robot where you're just taking things, placing them here, going here, doing this, without you even understanding the reason behind it or the theory behind whatever you're doing. It is very important. Sorry, I did see. Please, if you're just joining, please can you just let me know, because there are some people that did indicate to me that they were having network issues. So I just want to make sure that everyone has connected. Okay, so that's something that we have to really, really take into consideration, please. As new nurses, once we are coming into the field, we are coming in with so much to share. And sometimes because we are coming in new, we don't really know a lot. We meet experienced staff and we be like, we let our standards slip because again, they've been there for a long time. Again, you don't want to challenge them. Again, you don't feel comfortable and confident in challenging them. And at the end of the day, now you just let everything slide down. Always think about it. What if that patient you're attending to is your mom, is your dad, is your sister, or is your brother? Will you let that go? That's a question. If it was something that, because majority of the times, if it's not someone that is close to you, you might feel like, oh, that is fine. But think about it. If it's your mom or your dad or your sister or your brother or your very close friend, will you just let it be that way? Are you going to attend to them the same way you're attending to that patient? Because at the end of the day, the person that is coming to you as a patient is somebody's loved one. That is the reality. Okay, please, what's your name? Because it says there Infinix. Please. Okay. So at the end of the day, that person you're attending to really is somebody's mom, somebody's dad, somebody's sister, somebody's brother, and they are so dear to their heart. Oh, hi, Tabitha. Okay, welcome. Thank you. Thank you for joining. I think you mentioned earlier that you'll be joining later. Okay, so you have to have this at the back of your mind. This person I'm dealing with is a dear one to someone else. And what if it was my mom or my dad or my sister or my brother? Will I behave the same? So always think about it that way. Don't just be a robot where you're doing things because they are there. Think about it. Is this the best thing to do? Is there a better way of doing it? At the end of the day, that is how policies are being readjusted. Thinking critically, finding better ways of doing it. 5 years ago, there are things that we used to do and thought they were the best, but there are things that have come now to say, okay, this is a better way of doing it. So we always have to find a better way of doing things and making sure that every opportunity that we have, we are trying as much as we can to improve on our skills, right? So for the next 5 minutes, I will just go a little bit into email writing. Okay, yeah. Sorry, I was just reading from the group, like the people that were unable to join. So I'll go into email writing. You see, email is a very important way of communicating. WhatsApp is easy, Facebook Messenger is easy, but when it comes to email writing, it is something that it's a legal thing. You can use it for legal backing. Again, your WhatsApp chats can disappear, but what you write, your emails, they are very important. And if you're reaching out to organizations or employers, the best way of doing it is by email. And a lot of people do not know how to actually craft a good email. Again, you don't need to, it shouldn't be like there is no one standard to say, okay, this is the standard bit. There are steps that once you follow them and you're able to write those emails, it will be important. So the first thing you need to know about emails is, if you are writing an email to an organization, and maybe, for example, it's been 7 days and they haven't responded to you, and now you want to write them an email, you don't need to go and start writing a new email. You just need to go under that email that you previously wrote and follow up from there. Unless it is a separate thing that is unrelated to that aspect that you previously wrote on, and then that's fine. You can go and create another email, right? But if it's a follow-up, don't go and write a new email from afresh. You need to continue from where you stopped. That is actually writing a follow-up email. And when it comes to email, a couple of things that you need to take into consideration. First and foremost, you need to know, who am I writing to? Are you writing to an individual? Are you writing to an organization? Do you know the person directly that you are writing to? Or it is just you're not very sure? You are not very sure about the person. What is the subject of that email that you're writing, and how do you sign the email at the end of it all. Those are the things that you need to take into consideration before you can actually write your email. So talking about the subject of an email, it is very important. For the subject, you want the person you're sending that email to be able to know what that email is about. So you're not writing everything, because I've seen somebody previously copied the body of an email and wrote it under the subject. No, the subject is just a direct message, so that when the person picks up your email and just sees the subject, they can be able to know that this is what you want to talk about. So it needs to be brief, concise, but being able to capture your key message. You get what I mean? In case you have any questions, please drop in the comments. So you need to be straightforward. You need to capture your key points so that anybody reading the message should know. If you send a message without a subject, majority of the times, people, those that you're sending the email to, they might miss it, or they might not read it at all. There are people that if you send them an email without a subject, they will not read it. They don't have the whole time in the world to start figuring out your email. And because again, there are a lot of people that do spam people's emails. So if you send an email without a subject, people will not even look at it, because your subject will catch their attention. You know, when you have a message, let me take for example, if a message comes into your phone, at least you are able to read the first few words of that email, or that message. Anyways, the first few words can already tell you that, oh, this is what this person is already trying to say. For example, good morning, how, you already know that person is already something that the person is getting into. But if you send an empty email without any subjects, the person is not sure about what you want to talk about. And so majority of the times, they might not even read it, or they might even miss it, right? So the first thing, you need to write your subject. And again, when you've written your subject of the email, you want to compose your email. So again, you can start with the greetings at the top. If you know who you're writing to, you can just write their names, and just say maybe, hello, I hope this email finds you well. I hope you are well. Those are common ways of introducing an email. So when you write that, you just give a bit of a space and you write the body of your email. You start now writing the body of your email. You construct the body of your email. Don't give it all blocked together, because previously I've had somebody told me, oh, I sent an email to this organization. They've not responded in the past, like it was 2 weeks. And I said, this is unusual. On a normal day, if you send an email to this organization, they will respond to you. Then I said, okay, what was it about? Then he told me. Then I asked him, can you tell me what you wrote in the email? Actually, I just asked you, can you tell me what you actually captured in the email? And then he sent me a screenshot of the email. Guess what? Everything was in block. So the hello, madam, I hope this email finds you well. And the body of the email and the signature was all in block, all capitalized. Tell me, you're sending this to an organization that you expect them to respond. Who is going to read that message? They'll first of all come across you as somebody that is not serious, So I taught him, okay, you see this email, you need to restructure it and write it out in a professional way, so that anybody that picks, and then there was no subject. Again, to make it worse, there was no subject. So he wrote the email, and within 3 days, the organization responded. Although it was not a positive response, but at least they responded. So you know what you are doing. You are not doubting if they've responded or they've not responded. Are they happy with it or they are not happy? Now you know they've given you the response. So you don't need to write everything in block. The greetings, yeah. The greetings at the top, give space, and you write the body of the image. That is the main thing that you're capturing the image. In your email, again, let it be brief, let it be concise. You can explain as much as possible, but make sure that you are not repeating the same thing over and over. Because again, you want your message to be passed across directly, and you don't want that continuous repetition. And at the end of it all, when you've written the key body, you can now do like a call to action. For example, if it's something you're asking for an opportunity, you can say, thank you for your consideration, or I'm looking forward to hearing from you. Stuff like that. You can give, how long should an email be? Does it require explaining everything? An email should be long depending on depending on what you're trying to say, but you should try as much as possible to only capture the key aspects that you need to communicate in that email, right? So if you want to write, for example, depending on the topic that you want to capture, you should make your email, that can be reflected in the length of the email. But what I'm trying to make you understand is capture the important points, the most important points, capture it. Anything that is a repetition or an explanation of a previous point above, unless it is required, do not explain over and over again. Because there's a tendency that you might write a first paragraph capturing your main points, go again to a second paragraph, oh no, go to the first paragraph and write things that are not important, and then go to the second paragraph and now you're writing your real points. That person is already fed up with the first paragraph. They will not even pay attention to your second paragraph, and that is where your key message was. So once you've given that greetings at the top, make sure the next thing, you're capturing the reason for writing your email directly. Don't go back and forth, go straight to the point. And when you're done stating your key points, you can go down at the bottom and say, thank you for your consideration. I'm looking forward to this. Let me know if you have any further questions regarding this, or, kind of just a call to action, so that if the person thinks about something they want to ask you, or they want to come back to you, or if it's an opportunity, just saying thank you for your consideration, it's already a positive way of ending your email. Then you can actually say many thanks, thank you, yours sincerely, or you can say kind regards. So the ending also depends on how you started. For example, most of the times if I'm writing an email and maybe I'm responding to your email, I say thank you for your email, this, that. At the end of it, I will not say thank you again. I'll just say kind regards, Kendria. So depending on how you structure the body, you can determine how you end it. And sometimes if you're writing to an organization, you can say kind regards or yours sincerely or stuff like that. So it all depends. But the most important thing is the subject of that email, the body of that email, and your call to action, what you are expecting them, or is there something you want them to do? Is there something you are ending it maybe in a positive note? Or is there any follow-up that you'll be doing later on? And if you have to do a follow-up later on, or if maybe the institution responds to your email, don't go and start a new email to respond to them. They will miss it. Let the conversation continue. So you just need to go back to a place where you find reply, and you write the reply and follow up. If you're done with that particular thing, and maybe in the future, you want to write them again about something that is not related to your previous email, don't go and write it under that one. Create a new email and start from there and follow the process all over again. I hope that was helpful. And if you have any questions regarding that, please do let me know. So like I said, it requires explaining everything. Yeah, you can explain. You can explain, but make sure you're capturing your key points. And where possible, let your key points come first. Don't drift around and come to your second paragraph or at the end of it and before you start stating your points. Normally, even you as a human being, when you have something besides you, before you that you want to read it, you first of all, your attention at the start of it is very high. And the way the thing is written, you also determine how we will concentrate throughout it. But if something starts in a very, a way that is not really professional, or a way that you feel like, oh, this is not really sounding right to me, you might just skip everything and read the conclusion or just let it go. So it's very important that you always capture the subjects, the greetings, the paragraph where you're stating your key points, then you can sign it at the end. Any questions, please? Any questions?